Today, an interview in action from the ViVE event down here in Miami. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. We want to thank our show sponsors who are investing in developing the next generation of health leaders: Gordian Dynamics, Quil Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. And now, on to our interview. All right, here we are, Chime. No, we're not at Chime.
We're not at Chime, we're at ViVE.
ViVE. Here we are, ViVE 2022, and it is partially Chime, partially the health conference coming together. Pretty interesting. We're with Carina Edwards with Quil Health. Exciting times for you guys.
Very exciting times. We announced today our direct-to-consumer product offering, so very excited to be here. We now have two offerings. Quil Engage, the care engagement platform that integrates with all of our wonderful provider organizations. And now, direct-to-consumer in the home, ambient sensors, door sensors to really enable this silver tsunami to age in place for as long as they would like independently.
Age in place?
Yes.
Okay. Do I get any credit for this? Because I talked about my father-in-law and caring for...
Nope, you don't.
No credit at all?
Because everyone, I'm managing for
I know,
over
there has to be.
We all have this.
I mean, what's the number? I mean,
94 million Americans will be over 65 in the next 20 years.
But caring for your parents as they get older and those kind of things, this is that kind of solution.
It is.
That's going to give me alerts, let them live on their own longer. And give me the alerts I need. But, you know, even when they were in my house, even when he was in my house, I was like, we went to go out for dinner. Like, we needed alerts. And
so the way that works is basically we're using ambient sensing, so no cameras.
No cameras.
No cameras. So it's motion detectors, door sensors, drawer sensors, and then the machine learning in the hub learns the patterns in the home, and that it's almost the absence or the change of daily living that alerts you. So it's, mom normally goes to the kitchen 3 times a day. She's not been there. Mom walked into the bathroom and has not, it's been longer than normal. So things that are, I know that, hey, it's healthcare.
No, here's the problem. I'm sitting there going, can I sit down with your product guy? Because there's, here's where we could go with this. And there's really a lot of directions you can go with this.
Huge. So we're starting direct to consumer because that's the Comcast side of this lovely digital health venture.
Right.
And then IBC, great Blue Cross Blue Shield, Blue Cross payer. That is the great opportunity for Medicare Advantage, going to their book. And then you think about our foundational customer on Quil Engage, Penn Medicine. We're going to really connect PA5 in a new way, and that's been the fun of this R&D offshoot of Quil. We have the longevity, we have the time to really innovate and get these signals right and make sure they're actionable by every single person in the value chain.
You know what somebody did ask me, and I have to ask you, which is this only available where Comcast is?
No.
It's not, okay. So
there'll be a differentiator. So Quil Assure today is available nationwide. It's a self-install kit of motion detectors in a hub. That hub has a cellular backup plus broadband connectivity.
Okay.
Soon coming, that lovely Comcast gateway. We can reduce a lot of the footprint and the pain of setup if we integrate to the gateway, and everything in Quil Assure today is Zigbee compatible, and that gateway is Zigbee compatible. So in a future version, there will be a Comcast connected offering as well that will be unique to them.
So is this your team had to be busy during the pandemic.
A little bit.
Did you get pulled in a lot of different directions, or was this a focus for a while now?
So this was part of the thesis, right? So when we were started in 2019, it was all about how do we think about the evolution to the connected home, and the home is the hub of health. We started prescribed by provider because that was the point of activation, getting 82% of our patients to actually come onto the platform and engage.
So your solution is prescribed by provider. See the provider, they look at you and they go, hey, this solution would really help you.
Correct.
Okay.
So that's helping them through their hip replacements, their joint replacements, their ENT surgeries, their oncology
and
diagnosis.
And this is what we've talked about before.
Correct.
Okay.
So now that was also getting signals from the home, right? Patient monitoring, thinking about like, how are you feeling today? Pain scale 0 to 10. Now we're doing the second flank, connecting the home, and the convergence happens when you think about these ambient signals. If we can think through the right clinical use cases, where is that opportunity to bridge the two worlds to now have new insights for care managers that are managing populations that they don't have access to before in a consumer-friendly way?
All right, direct to consumer, that's awesome.
It's fun and different.
Okay, so everyone who listens to this is going to be consumer, but most people who listen to this show are going to be providers.
Yes.
So what's the message to providers?
This is enabling your care at home opportunities. So this is the beginning of us exploring the hospital at home, connected home in a new way for new clinical insights and empowering new service lines. With the reimbursement changes, the ability to actually get reimbursed for telehealth and remote monitoring, these are new things to bring new services to bear for providers to follow patients from discharge to home. We don't want to be the coach. You're the provider.
Right.
We want to be the technology enablement to give you insights and ears when you can't be there in person and you have patients that are just well enough to be home but not sick enough to be in the hospital. So these transitions home are critical.
All right, so I think about that transition home. All right, so you're monitoring things like activity outside the norm.
Yes.
But I think of things like med adherence. Immediately I think of med adherence.
Yeah. That's part of the monitoring. So the way we're doing that is when you get Quil Assure today, direct to consumer, it's an app and an ecosystem. And in the app side of it, we, mom, dad, can enable you, the caregiver, family member, to bring in their meds, give reminders. It connects to Apple and Alexa Voice, set reminders, be able to give them notifications and text messages when it's time to take things, have them acknowledge on the app that they've taken it. So now your conversations are around life, not like, did you take your meds? How you doing today? So it's really helping improve the relationship of mom and the caregiver, because you lived through this with your family.
Yeah, you know what's interesting is we look at that generation and we say, well, not tech savvy, but we used Siri and we used Amazon Echo extensively.
Correct.
With her father, because it was such a natural conversation for him.
Yep.
It was like, the same thing he would say, hey, play my Johnny Cash.
Check.
Eventually would say, hey Dale, did you take your med today? And he'd go, my med.
Correct.
I had whatever. I'm sure it would be more specific than that.
It is more specific than that, but the other fun thing too, it's also, we've seen the pandemic, the literacy in the senior population that was connected has gone up through the roof.
Oh, really?
We saw in the last 18 months, even patients on Quil Engage, the provider side, our demographics are growing older. People are more adopting they're used to Facebook now, they're used to FaceTime now. Like my aunt and uncle, if I'm not on FaceTime, it's like a crime. It's like, wait a second, where are you? Why can't I see you?
And most have done a telehealth visit, most have done while interacting with their kids that way. It's
become second nature. And so I think now with the connectivity and the receptive enough is the way we put it.
But plus the technology is getting more, it's being designed by people who are more empathetic and understanding what's going on and saying, all right, this isn't easy enough for my grandfather to use yet. And I like how we're interacting. So you were providing through the set-top box a bunch of ways for health systems to drive content down right to the end user. One of the things we talked about is we had an initiative where we were actually the discharge notes and whatnot. We were actually videoing the doctor saying some things, sending that stuff down. Is that a part of that platform?
So right now the two platforms will merge together on things that are provider prescribed care plans, because anyone that has Comcast and Quil Engage application, they can pair their experience. So now on the TV you can get that app. But we're also doing caregiver journeys for those in the connected direct-to-consumer world. We'll invite the caregiver on a journey to how to have those conversations that are hard to start with your independent parents, because they want to be independent, and so it's almost training the care family members. How do you bring up advanced directives? How do you bring up transitions of care? What are the thought starters? You don't want to wait till the adverse event happens and then she broke her hip and she was in the hospital, so now she has to come live with you. You want to have those conversations sooner as they're living independently.
It's interesting. My wife's father, I get to tell these stories to you, so I appreciate you hearing them. He said, okay, when I die, this is what you're going to do. He's that guy.
That guy.
And then we were going through his papers after he died, and he had like notes in there to her, like, I'm probably gone if you're reading this, and that kind of stuff.
That's so sweet.
My parents won't talk about it.
No.
They won't talk about it at all. It's like the complete opposite. And I'm like, we don't know how. None of us were like, a lot of us weren't trained caregivers.
Yes.
And so to the extent that these health systems can come in, partner with us, and help us to do these things, it's, I'm almost making a plea here. It's like, we need your help.
Oh, the power of storytelling here is huge. That's where I love some of our video content, because even, you think about some of the TV shows that everybody binge watches, right? Sometimes that opens up a dialogue. Like what you just saw, if you're with your family member and they saw somebody, oh, I would never do that, or I would, it opens up these thought starters, so we're bringing a lot of personal experience, personal testimonials, seniors telling them, I wish I would have, in their own voice, and it's a trusted peer group.
That's really interesting. Is there anything else about the company? Because I love just talking to you. So.
Yeah, no, the company's doing great. We are thrilled to be here at this event, and we just always want to thank our provider customers because they gave us our start. They were foundational, and now I'm really excited for phase 2.
Phase 2, fantastic. What are you binge watching?
Oh my goodness, what am I binge watching right now? Oh, it's really bad.
Oh,
it's really bad. It's Sweet Magnolias on Netflix. It's so bad, it's actually good.
We made it through the first season of Yellowstone, and I just couldn't take it anymore. But my wife's name is Beth.
Okay.
And so Beth is this character on Yellowstone that everyone's just like enamored with, and she made it through, I think, 2 seasons. And I'm like, these people make bad decisions.
Yeah. Oh yeah, this is all about Southern belles, and they're living their best lives, and they're having all their family. It's bad.
It's bad. And they make bad decision after bad decision. What was the other one? Oh, well, obviously we all did Ted Lasso.
Oh, I love Ted Lasso.
I know.
That was a favorite. My other favorite was I did in Just Like That, the Sex and the City remake.
Oh, I didn't see that.
Oh yeah, HBO and Just Like That, and it's their 20 years later they're back together.
Wow. Did you watch any of the reunions? Did you watch the Friends reunion on HBO?
Nope.
I did watch the Friends.
Was it good?
I have to apologize. I mean, I feel like I shouldn't have watched it, but
don't apologize.
But my gosh, they're so funny.
They're great. That's just imagine this gave us the break that we needed, the mental break in the pandemic. I feel like everyone, in a way, I'm done with screen time a little bit. I'm trying to get more outdoor experiences now that we can be outside and it's no longer 20 degrees and all that fun stuff.
I live in Naples. It's never 20 degrees.
Well, then it's not. When it's 120.
When it's 120 degrees, absolutely. Has your organization come back to the office?
No. So we actually, during the pandemic, we scaled so quickly. The race for talent, we hired in 20 states. So we literally have employees, Quillians as we call them. So Quillians in 20 states, and it's been great. We have a virtual first mentality, and now we're starting to do quarterly planning in the office and bringing key groups together when they need to be, but when they don't need to be, we've been doing phenomenal virtual.
Any challenge finding certain positions?
Oh my goodness, yep.
All right, so who are you trying to find?
We are trying to find SREs, back-end engineers. We're trying to find great UX UI people. We're trying to find, trying to think through, we got marketing done. We're scaling, thank you, off screen. But it's really engineering. It's been the hardest push. And I'll give a shout out, right? We have 27% of our engineering capacity is in Ukraine, and so we are working closely with that vendor to make sure everyone's okay and making sure that they're able to get paid and they're able to really focus on their families and their lives.
It's I mean, it's devastating.
Yeah.
Somebody said, it's a conflict. I'm like, it's a conflict if you live in the United States. It's a war if you live in the
It's a war if you live there. And these are people that are literally showing up to work with such pride and job, having dropped their kids and wives off at the border. It's just, we tell them, you don't need to work. It's okay, we got this. And they want to work. They're amazing.
They need to work. It is devastating. Carina, it is always fantastic to catch up with you.
Thank you.
And we didn't even talk New York Giants.
We didn't, and hey, it's a rebuilding year. That's all I can say. It's another rebuilding year.
Another rebuilding year. Here we go. And then you got to follow the, well, actually, I don't know if we have a baseball contract yet. Do you follow the Phillies?
No.
You don't care?
I don't do baseball.
I don't do baseball.
As far as like a team that I have a huge allegiance to, like I'll go to a game and enjoy it, but it's not my sport.
The last time I interviewed you, we started the conversation like this. We spent 5 minutes on sports.
On Giants, yeah.
And somebody sent me an email. It's like, when you talk to Carina, I don't want to hear about the Giants first. Do that at the end of the interview.
Perfect.
So that's what we're doing here.
Awesome.
So thank you again.
Thank you.
Appreciate it.